Welcome to our educational video on gangrene. Gangrene is a form of necrosis characterized by the death of tissue, often due to ischemia or infection leading to the superadded putrefaction by bacteria. There are two main forms of gangrene, dry and wet, and variant form of wet gangrene called gas gangrene. What is dry gangrene? It typically begins in the distal part of limb due to ischemia, often from conditions like atherosclerosis, Buerger's disease, Raynaud's disease, or trauma. It is usually initiated in areas with limited blood supply, such as the toes or feet. The primary cause is lack of blood supply, leading to tissue death. The affected tissue undergoes coagulative necrosis due to ischemia, where the tissue becomes dry, shriveled, and dark. The dry environment limits bacterial growth, which helps in containing the necrosis. However, putrefactive bacteria can still cause liquefaction over time. Morphological features of dry gangrene. The gross features. The affected area is dry, shriveled, and dark, often black, resembling mummy. This is due to the liberation of hemoglobin from hemolyzed red blood cells, which gets converted into black iron sulfide. There is clear line of separation between the gangrenous part and the viable tissue, which is crucial for surgical intervention. The histological features of dry gangrene shows coagulative necrosis of the skin, muscle, and other soft tissues with thrombosed vessels. The next one is wet gangrene. It occurs in naturally moist tissues like the mouth, bowel, lung, cervix, vulva, etc. It's often associated with diabetic foot due to high sugar content favoring bacterial growth. Bed sores, pressure on sites like the sacrum, buttocks, and heels, and conditions like strangulated hernia or intussusception can also lead to wet gangrene. The moist environment promotes bacterial growth, leading to rapid tissue death and putrefaction. Unlike dry gangrene, wet gangrene involves liquefactive necrosis, where the tissue becomes soft, swollen, and dark due to bacterial action and inflammation. Morphological features of wet gangrene. Gross features. The affected area is swollen, soft, moist, and often dark or greenish-black due to bacterial action and blood staining. There might be gas formation in cases like gas gangrene. The line of demarcation is less clear compared to dry gangrene, making surgical demarcation challenging. The histological feature shows coagulative necrosis with bacterial infiltration, inflammatory cells, and sometimes gas bubbles in the tissue. These are some differences between dry and wet gangrene. There is a special form of wet gangrene called gas gangrene. It is a severe form of wet gangrene caused by gas-forming bacteria like Clostridia, which gain entry through wounds or contaminated surgical sites. It leads to rapid tissue necrosis and systemic toxicity due to bacterial toxins. Grossly, the affected area is swollen, edematous, painful, and crepitant due to accumulation of gas bubbles within the tissues. Microscopically, the muscle fibers undergo coagulative necrosis with liquefaction. Large number of gram-positive bacilli can be identified. If you found this video helpful, please like, share, and subscribe.